In recent years, there has been a constant debate on whether it is appropriate or not to legalize physician-assisted suicide in the United States. Physician-assisted suicide is the practice of a physician administering a suffering, terminally ill patient only upon their request a lethal medication to take at a time they choose in order to end their life. For a patient to meet the requirements of being able to receive this lethal medication, they must be diagnosed as terminally ill, where they are likely to only live for another 6 months. They also must be competent to be able to make medical decisions on their own without any mental health concerns. Patient consent is a key aspect that separates physician-assisted suicide from murder. That makes it morally acceptable for physicians to take part in causing death intentionally. There are many rules that are put into place, like there being a 15-day waiting period between the time the patient requests the medication and the time the physician writes the prescription for them. Strict criteria and guidelines are established when dealing with this life or death situation. The patient will first take an antiemetic, then 45 to 60 minutes later, they will take 9 grams of a short-acting barbiturate. Once these steps are completed, the patient will then peacefully die. CNN shared the story of Matt, who is living with metastatic melanoma. Matt's wife explains in the video that all he wants is to have the ability to end his life peacefully with dignity on his own terms. Right now, it's about mainly making him as comfortable as possible, but in the future, he wants to be able to control how he dies from dealing with this illness. After the right to die was brought up into the forefront of the news, 68% of the public was in favor of physician-assisted suicide and 28% against. There are currently 9 U.S. states plus the District of Columbia that have physician-assisted suicide laws in effect. Colorado, Hawaii, Oregon, Vermont, and Washington all have mandated state laws. New Jersey and Maine have approved laws just this year, too. Montana and California have a court ruling that makes it legal in their states. In other countries, such as Belgium, Luxembourg, and the Netherlands, physician-assisted suicide is legalized. Switzerland, Finland, Austria, and Germany allow physician-assisted death in certain situations, which makes it a big debate in the United States over whether or not it should be approved. ABC News filmed David Goodall's last days in Switzerland, specifically his last hours of his life, to show the physician-assisted suicide process. He was 104 years old, and he wanted to take control of how he was going to die, because he wanted it in a peaceful way, surrounded by his loved ones. They explained how before he can end his own life, he must show he understands the nature of his decision, and they showed this by showing his grandson asking him questions regarding his mental state. He was then taught how to administer himself the lethal drug, where he then fell asleep in his own bed surrounded by his family members, then peacefully passed away. Patients suffering from a severe medical condition usually have extremely painful experiences. Physicians are presenting the terminally ill with advanced palliative care that they deserve for the amount of pain and suffering they have to endure on a daily basis, although sometimes this care is just not enough. After the physician does everything in their power to relieve their patient's pain and there are no more realistic alternatives, all the patient wants is to be at peace because the pain is just too much for them to handle anymore. Laws governing medical treatments will influence the relationship between the physician and the patient, plus it will shape the behavior of the physician too. The decision of physician-assisted suicide is in the control of both the physician and the patient. Patients that are choosing this option view it as allowing them to have complete control over their life and planning for their death. Also, it lets these patients know when to say their last goodbyes to their family and friends, as well as prepare themselves mentally for their death. I think that it would be promoting a quality dying experience because for a patient that is living in constant, unbearable pain, it would only be a relief to them to end their suffering. Plus, it would be in an ethical, peaceful manner. Even though this is such a controversial issue, I believe that physician-assisted suicide should be an option for patients that have no other alternatives to improve their health and quality of life. It is a way for them to end their suffering in peace. I hope you have learned more about the physician-assisted suicide process because so many people assume, due to the word suicide being involved in the phrase, that doctors are killing their patients. But now, after viewing my presentation, you should understand that it is just not the case. It causes a big debate in the country, but in my opinion, if someone is no longer comfortably living their life and know they do not have much more time to live because of their poor health status, they should be able to have this as an option. Thanks for watching.